I'm Dr. Gaby Cora, and welcome to my Wellness Doctor and Coach certification program exclusively for physicians. Now, why physicians? Well, many of us have really joined our profession to be not only the doctors who help in pathology, but also help our patients achieve their maximum health and wellness, their ultimate health and wellness. And yet, with the current state of healthcare, many of us cannot do this, but at the same time, we've seen many other people come into the healthcare arena and provide for some of the services that we should be providing. So if you feel that you're one of the doctors who really went into medicine to help out, not only fix the problems, but also heal people on a very high level, thank you for joining me. Now, what's particular about this Wellness Doctor and Coach certification program for physicians? Well, first of all, it's given from physicians to physicians. So there's something very unique about that particular part of this program per se. The second one is that we're going to see not only things about coaching per se, but I'm going to help you build your whole empire around health and coaching and practicing medicine the way that you were meant to practice. So this will include tons around speaking engagement, corporate health and wellness programs, consulting programs, coaching per se, of course, networking, social media, and many other things that you would only be able to learn by doing an MBA as I've done, plus joining many other separate programs. This program brings everything together. The third point that is very important here to share is that you're going to be part of a very unique and elite group of physicians way ahead of your curve. So as a pioneer in this area, I invite you to join me in the Wellness Doctor and Coach certification program. About a decade ago, I was contacted by a coaching group, and I was stunned to hear that they wanted me to have a coaching certification to be able to be a part of their coaches. I couldn't understand why that coaching certification was more important than my 4 years of psychiatry training. I was really very surprised, and at the same time, going through that path over the past 10 years, I somewhat realized why it was important to have a bit more than my formal training as a psychiatrist. Now, there's so many people these days that are going into coaching. There's thousands of people, and believe it or not, some of those people are charging more money and are earning more money than you as a physician are able to earn. This is whether or not you're working as a primary care physician, as a specialist in some areas, or in psychiatry, as it's my case. Part of this has directly to do with the overhead that you may have as a physician, with staff that you may have, maybe a coordinator in the front, maybe a nurse, maybe some technicians. So think about some of those issues that affect your practice as a physician in contrast with that practice as a coach. The other part that is important is that many coaches are coming in as a middle person between you, the physician, as well as companies or insurance companies. So this has created a third tier of direct payment. Believe it or not, some of these coaches are not paid through healthcare dollars, but are directly paid through business dollars that are completely tax deductible. So this is driving you, unfortunately, farther and farther away from being able to provide for care for your patients. And that's my third point. Unfortunately, many physicians have gone into healthcare and into medicine to help people out, to be the healers that we were meant to be. And many people feel that this distance that has been created by the whole system has brought them farther and farther away from the real mission and purpose that many of you, like myself, may have had in terms of going into the medical profession. So this is as an introduction into why coaching would be so important. Now, there's different points that I want to address during this mini seminar. There's going to be many more points that we're going to address once you sign up for the Wellness Doctor and Coach Certification Program, a full seminar going really more into depth. But just as a glimpse of what you may want to think about in terms of the differences between being a physician and or being a coach. Well, as a physician, you know we need to be licensed in different states. So currently, for example, I'm licensed in the state of Florida. In the past, I've also been licensed in Maryland and in the DC area. However, right now, as a practicing physician and psychiatrist, I should only be able to provide for my services within Florida, right? Whereas as a coach, you basically can coach anyone, anywhere, not only within your own state, but across the states and globally. So that's an interesting advantage. There are some details that we need to look into to make sure that you're covered, that you're still doing the right things for yourself as a physician and for your patients and or for your clients if you decide to be a coach. There's other issues around ethics. Interestingly, in medicine, and more so in psychiatry, actually in psychiatry we have the highest degree, the highest bar in ethics, whereas in medicine I think we have a very high bar as well. However, although there's obviously some ethics bar positioned and placed here for coaches, it's really nowhere close to what we encounter as physicians. Among other things, for example, the coaching relationship is a business relationship. So in a business relationship, for instance, you can go lunch with your clients, you can enter into other business ventures with your clients, and you can do even more things in terms of that business relationship with your clients, including becoming friends. Whereas within the medical profession, we can't. More so in psychiatry. In psychiatry, for example, we can never come into a personal relationship with any of our patients. So that's why the bar is very high. There are some issues, as I'm just mentioning, that we need to know in advance whenever we want to start one or combine our practices as physicians as well as coaches. In terms of one of the most interesting themes around coaching and being a physician also has directly to do with healthcare dollars and or business dollars. So for example, if you're working directly with people, you will need to either work through insurance companies and or have a certain way of payment either directly from your patient and or from their insurance company. So all of these healthcare dollars come within certain restrictions, whereas if you really want to venture into the coaching world, this is more of a business relationship. So those dollars that are paid to you may be tax deductible if the person is paying you individually, and or if you're doing work for a company or within a group of people, those dollars may come from business dollars and may be a lot easier for the company to justify in a way. So these are just some examples of the differences between having a coaching practice as compared to a medical practice. A second point here that I feel is very advantageous for physicians who want to go into the health and wellness program in a way is that physicians are trained. We have the profound sense of understanding and knowledge, not only in terms of medicine, but in health. On the other side, healthcare these days has pushed us to only look at pathology and what needs to be fixed. But most of us have really been trained in the full range of health and wellness. And I think that that gives us a great advantage to be able to become amazing health and wellness coaches. The second part is that many of us have also been trained to provide for great behavioral modification ways in which we can help our patients. Unfortunately, on the other hand, physicians have been pressured to spend less and less time with their patients. So they have, in general, come to a cookie-cutting approach where it's very fast and very superficial. This is another great opportunity for physicians who want to do more and better with their patients to join the program and learn more of that behavioral health and modification program so that we can help people continue on their wellness path, and so that they can achieve their ultimate well-being. Another interesting part here is that in this full range of our understanding of health and wellness, I think we have a particular advantage in being able to not only address some of the things that need to be fixed, but also help people see the whole picture and help them guide through that path because of our credibility. We're really uniquely positioned in a place where people respect us because of that knowledge. And that's one of the things that I've found, even when people have hired me as a coach, the fact that I am a physician and that I am board certified and that I have been pretty busy within the medical world has given me that clout and that opportunity to be hired in some very interesting cases and in some very interesting opportunities. Now, on the downside, many business coaches have come from a business background. So many of them may have been human resource people, or they may have been in business, but many of them may have also burned out. So in a way, they may try to come in as life coaches or help people in health and wellness when they've really burnt out and they don't necessarily fully understand what's going on behind the scenes in that full health and wellness part. Another advantage that they have is they've done tremendous marketing. So people in general are more open many times to hire someone who offers life coaching services because they've really marketed themselves well. So that's a disadvantage that we have, physicians have. But at the same time, this is one of the reasons why I really want to help you maximize your marketing opportunities so that people continue to see you with that credibility, with that positioning, with all your knowledge, acumen from all these years and that experience. So that's the second point in which we have some advantages. And the third part is we have some very unique opportunities. With everything that's happening in healthcare, unfortunately, what we're going to see is that some people are going to be provided for some very basic forms of preventive medicine. And it's going to be, we're going to have like a dual program where some people are going to really be provided for the basics. But I also believe that some people are really going to continue to want to maximize and improve their performance and productivity in a way in which they're going to trust a credible professional that's going to work with them directly. I think there's some amazing opportunities there where we can position ourselves in this unique place where we are the masters of health and wellness and where we can really help the public at large. So hope you enjoyed this snapshot, this sneak preview of the coaching section, and we're going to see some more. I look forward to seeing you. Thank you so much for watching. I hope you enjoyed the sneak preview of the Wellness Doctor and Coach Certification Program, and I look forward to seeing you in July. Now, how can you sign up? Very simple, by filling out a form that you need to request directly to me on my private email. What is my private email? It's gcl@drgabycora.com. So write me a private email at gcl@drgabycora.com. Request the form to sign up, and you'll be one of a group of 12 people coming in and joining me on the Wellness Doctor and Coach Certification Program. Thank you so much for watching. I look forward to seeing you in Miami in July.